Hi, I'm Dr. Duffey. I work at Georgia College in the Counseling Center as a psychiatrist there. This video about social anxiety disorder is part of a series on how to get ready for college in trying times. When you think about all the events you're going to have to attend in college, you may wonder whether the anxiety you feel in anticipation is normal. Maybe you've heard others talk about social anxiety disorder and you question whether you have it. I hope this video will help you decide as well as provide some treatment options if you need them. Most people who have social anxiety disorder would say it started for them sometime between ages 8 and 15. So ask yourself, did your symptoms start that far back? And they would need to have lasted for 6 months. There are several things that would help you distinguish social anxiety from other anxiety problems. If you have social anxiety disorder, you would have noticed your anxiety, even at everyday social situations, is much greater than the situation calls for. People don't generally like to be observed and scrutinized, but if you have social anxiety disorder, your anxiety about being observed and scrutinized is another order of magnitude greater. Many pieces go into having this more intense anxiety. You may fear others will see your anxiety and reject you socially. You may feel you're being judged by others and fear becoming embarrassed. And if you get embarrassed, you then have to worry about others seeing the signs of your anxiety, like being sweaty or nauseated or shaking or short of breath. If you have social anxiety disorder, having to interact socially consistently causes you distress. It's predictable and frequent and doesn't just happen on special occasions. It results in you either avoiding social situations more than other people do, or making yourself endure the situation with considerable discomfort. The level of distress you have is bad enough that it makes it hard to function in relationships or school or work. In short, you might say you could identify social anxiety disorder by its level of intensity, personal fear of being judged, the consistent frequency of it occurring, and the frequent avoidance of situations out of fear of embarrassment and being judged. There's some logical consequences of untreated social anxiety disorder that might also give you a clue that you have it. You might, for example, feel lonely or isolated and have had trouble making friends, and you might have become depressed about this social situation. You may find yourself drinking before you go out as a way of reducing your anxiety about going out. You may drink or use when you're out as well to allow you to tolerate being out. Sometimes your past history can be a clue you have it. For example, there may have been some past situations of being bullied about your weight or mistreated as a child that would cause you to expect to be mistreated. So, what if one of the things you're saying to yourself is, my symptoms are not that bad, but I'm still socially anxious? Then let's look at some of the other possibilities. The person with social anxiety does not prefer to be alone, like you might see in a person who's introverted or someone who has high functioning autism. And the anxiety producing situation is confined to social situations. And the person's not anxious in general. And sometimes people suffering from trauma, they feel unsafe even when they're alone. So it isn't just social situations. Even when they're alone, they feel unsafe. In people who are depressed, the withdrawal from others has its onset at the same time with the depression and was not present before. People who have long-standing habits of blaming others, projecting their negative feelings on others, or mistrusting others, they may retreat, but the social anxiety is not the most prominent feature in their retreating from interaction. Maybe the most common situation is that you're new to social interaction and feel awkward, but may learn to adjust in time and get over your shyness with practice. Not only is social anxiety disorder distressing, but untreated it can make you want to limit your career to one that doesn't require much socializing or dealing with the public. One of the lifetime risks of social anxiety is that you hate dating and having to meet strangers so much that you settle for a partner who's really not a good choice. You settle for Mr. or Mrs. Good Enough instead of Mr. or Mrs. Right. So, from listening to me, if you've determined that you have social anxiety, what can you do about it? Your counselor can help you with your social anxiety by providing a safe place to talk about your fears, help with skills training, and cognitive behavioral therapy, which may or may not include gradually exposing you to situations in which you can learn to overcome your social anxiety. Medications that selectively inhibit the reuptake of the messenger chemical serotonin, which are called SSRIs, are helpful with social anxiety. You may know these medications as antidepressants used most frequently to treat depression and anxiety. These medications include Zoloft, Prozac, and Paxil. Other medications that inhibit both serotonin and norepinephrine uptake, called SNRIs, are also used, like Effexor. Sometimes other short-acting medications can be prescribed for one-time situations, like giving a speech. These short-acting medications temporarily treat the symptoms, but not the underlying problem. If you've decided that you don't have social anxiety disorder but would still like to become better at socializing, take a look at page 91 of the PDF of the book Search, A Guide to College and Life that you can download by going to the Georgia College website. Go to the Counseling Center section, then look for the first Visit to Dr. Duffey tab to find the free PDF after the first couple of paragraphs. Also, please see the references in the YouTube notes, which were used in preparing this note. Thanks. Bye.